Okay, so here we're going to pick up where we left off, looking at the ligaments of the lower leg, ankle, and foot. So when in kind of looking at the ligaments, so all of the bones, and we know we have a lot of bones within the foot, are connected with ligaments. So an injury to a ligament, because we're going to make some clinical connections with some things here, because there's some relevance there, is called a what? So ligaments called a sprain. Okay, so most common ligaments to sustain a sprain, we have them all listed up here. On the lateral side, you have the anterior talofibular and calcaneofibular ligaments. On the medial side, you have the deltoid ligament, and it's actually a combination of 4 separate ligaments. The anterior surface, you have the anterior tibiofibular ligament, and then the posterior aspect, you have the posterior talofibular and the posterior tibiofibular. You also have a structure called the interosseous membrane, okay, and that's the long soft tissue structure that sits between the shafts of the tibia and fibula. They also refer to that as the syndesmosis. So it's kind of like a big broad ligament that kind of spans the entire distance between those two bones. So these are all the different ligaments that we're going to be looking at. Again, there's something to a name. So for instance, calcaneofibular. So what would the calcaneofibular ligament, so we know a ligament is a soft tissue, piece of soft tissue between two bones. It holds two bones together. So what two bones would the calcaneofibular ligament come from? Okay, they would come from the calcaneus and the fibula. Okay, so that's when you look at these names, there's something, like we say, sometimes in anatomy, there's something to a name. So bear that in mind when you're going through these. Okay, so here we look at the ligaments from a posterior view. So we mentioned some of these already on the previous slide. You have the interosseous membrane, or the syndesmosis, which is the broad ligamentous structure that sits between the fibula and the tibia. You're going to have the posterior tibiofibular ligament. You can see that right there, down on the distal end, the articulation between the tibia and the fibula. And you have the deltoid ligament. The deltoid ligament is a big, broad, thick ligament on the inside of the ankle. You can see when you look at the ankle joint, the stability that you get a lot more bony stability here on the lateral side, because the distal fibula goes a little bit further down, a little bit more distal, whereas the medial malleolus doesn't go down as far. So you need a much thicker, broad ligament to kind of support that inside part of the ankle. There's the calcaneofibular ligament. And then the posterior talofibular ligament. So those are the ligaments when you're looking at the posterior view of the ankle. So this next picture that I'm going to show, so here's a picture actually showing kind of what they, a little bit more of a realistic depiction of the ligaments. Again, these are all the same ligaments you saw on the previous slide, just a more representative picture, if you will, as far as what they look like. So you could take note of all the different structures there. Again, the deltoid ligament is a combination of 4 different ligaments. And then you have your other ligaments named after the 2 bones that they bring together. Okay, here are the ligaments on the lateral side of the ankle. Now, I don't have the animated arrows like I had in the previous slide, so I'm going to use the pointer here. So the posterior talofibular ligament, again, talofibular, talus to the fibula. Okay, that's letter A. Letter B, you have your calcaneofibular ligament, and you have your anterior talofibular ligament, talus fibula. So these 3 ligaments, when you talk about the most common ankle sprain, they're the ones that are most common, they're the ones that are effective. So the most common ankle sprain is a lateral ankle sprain, and that's when you plantar flex and invert your foot, or you could just do even a straight inversion where your ankle turns in. But those are the ligaments that would be affected. The anterior talofibular ligament is the one that's most commonly affected, but then the worse, the more severe the sprain, you'll involve the calcaneofibular and possibly the posterior talofibular ligament as well. If you look here, you also see you have the anterior tibiofibular and posterior tibiofibular. You can see those two as well. So this ligament, these ligaments up here, this region, if you've ever heard the term high ankle sprain, those are the ligaments that get damaged along with the syndesmosis, depending on how bad the high ankle sprain is, will also get affected. So if you ever heard the term high ankle sprain, that's what they're referring to. They're referring to a sprain up here, whereas your more common ankle sprain happens out on the outside part, the lateral portion of the ankle. And much like the last time, we'll show kind of a more representative picture of what these structures actually look like. So there's a couple other structures in here, and you could kind of take some time. Again, these notes are posted, so you can take a look at your notes and pictures in there and kind of get to see this. But, you know, make note of, again, kind of how they're orientated in this slide, and look at some of the other structures that are present as well. Okay, then we also have the deltoid ligament. So I was talking about the deltoid ligament before. Now there's different components to the deltoid ligament. The deltoid ligament is a very thick and strong ligament because it has to be, because you don't get the support. Again, we showed, you're able to really see it in the posterior view, but the lateral malleolus does not provide, or the medial malleolus, because we're looking at the medial side, the medial malleolus does not provide the same amount of bony stability that the lateral malleolus does. So the medial portion of the ankle doesn't have as much bony support. Part of the reason why inversion, you're more likely to have an inversion sprain is because the bony support on the outside kind of keeps the foot from everting or turning out. The issue is when this ligament injury does happen, so you can sprain. You can get what's called a medial ankle sprain. If you sprain / tear, you know, obviously a sprain is stretching or tearing of the ligaments, but depending on the severity, the ankle can become very unstable for the reason that when you damage this ligament, there's not a whole lot of bony stability to support the inside portion of the ankle. So here are comparing the medial and lateral ligaments. Okay, so if you look at the different views, so here is a picture of the medial. You can see the deltoid ligament there. Here is a picture of the lateral. So you see the lateral ligamentous complex is not nearly as thick and as strong. It's just 3 kind of separate ligaments present. Whereas when you look at the medial ligamentous complex, the deltoid ligament, it's very thick, very continuous, and again, it's for the reasons we cited earlier. Now, as I said, the deltoid ligament is actually made up of 4 different ligaments, okay? You have the anterior tibio-talar, you have the tibio-navicular, you have the tibio-calcaneal, and you have the posterior tibio-talar. Okay, those aren't pictured individually on there, but those are the names. So I'll run through those again. You have the anterior tibio-talar, because obviously we're coming off of the tibia. You have the tibio-navicular. You have the tibio-calcaneal, and the posterior tibio-talar. So those are the 4 ligaments that make up the deltoid ligament. And again, a very strong, thick ligamentous complex because they have to support that medial ankle. Okay, generally when we're looking at the ankle ligaments or the foot ligaments, they're basically supporting all of these different joints. So when we're getting down to the foot, okay, we have the intertarsal region, okay, so the intertarsal region is all in here. So all the intertarsal ligaments will be supporting that part of the foot. You have the tarsometatarsal ligaments, okay? So again, look at the name, tarsometatarsal. So that's the articulation where the tarsal bones, so these are all your tarsal bones here, where they articulate with the metatarsals. So that would be this joint right across here. Okay, so you see as I'm dragging the laser pointer, this is the end of the tarsal bones. Here's the beginning of the metatarsal bones. Okay, then you have the intermetatarsal. Then you have the metatarsal phalangeal. And then you have the interphalangeal. Okay, so here's your metatarsal bones right here. We mentioned this in the previous slide. So make sure that you're able to differentiate between the metatarsal phalangeal and then the interphalangeal, and make sure that you can label and basically identify specifically, naming the different joints up at the toes. Okay, so that's important to be able to do. So all the different ligaments inside the foot, if you go back and look at some of the pictures of even when we were talking about the ankle ligaments, there's basically a big bunch of ligaments that kind of fill in these areas. So make sure you could identify all of those different regions. Now we're going to look at some other important structures in and around the foot. So there's some other important structures that we have to make note of here. And one of them are the arches of the foot. Okay, so the created by the bones of the foot, and they're supported by some of the other soft tissue structures. We have various arches around the foot. So if you look at the illustration, we have different arches. We have the medial longitudinal arch, which kind of comes across here, and we'll talk about the structures involved with that. And then we have the transverse metatarsal arch, which comes around here. So those are some of the arches that we have. They're the two of the more prominent arches. You do actually have a lateral longitudinal arch that is actually more on the lateral side of the foot. We're going to focus on the medial longitudinal arch and the transverse metatarsal arch, as those tend to be the more prominent ones that people end up having issues with. So the medial longitudinal arch, so the reason why we have a medial longitudinal arch is for shock absorption. So one of the things you'll find with individuals is if they have an issue with that arch, whether it be that the arch is too high or the arch is too low, individuals on either end of that will end up having foot and ankle problems. Okay, so there's kind of like an optimal arch to have, and that allows for shock absorption and allows also for the foot to adapt to the ground appropriately. So the structures involved with the medial longitudinal arch are the calcaneus, the talus, the navicular, the first cuneiform, and the first metatarsal. So those are the structures. If you kind of draw a line up the foot, those are the ones involved with the medial longitudinal arch. And it's supported dynamically by the tib posterior and tib anterior. So there's soft tissue structures. Obviously, the ligaments are in the region are going to support that. The dynamic support for the structure is going to come from the tib anterior and the tib posterior and the tib anterior. So both of those muscles. So after this talk, go back and look at the origin and insertion of those muscles, and you could kind of see with the way they run and what their action is, how they will actually support this region and how they'll help in supporting the medial longitudinal arch. Okay, and we also have the transverse metatarsal arch. So the transverse arch of the metatarsal head. So this is another arch. It will assist in allowing the foot to adapt to the ground, and it goes across the foot from the first to the fifth metatarsal. So you can see the region that's circled, and you can kind of see how it looks from a transverse cut. So it consists of the arch that kind of runs through this part of the foot, and you could kind of see this. So when you kind of look at the foot from the front, so this would be looking at it anteriorly, is what this little picture is kind of representing. You kind of have an arch that goes along that part of the foot underneath still has kind of an arch. It's not completely flattened out. And again, it's just to help the foot adapt to the ground as you're walking. Okay, and then you have the plantar fascia, also known as the plantar aponeurosis. So it's basically a really thick structure. Okay, here's the plantar fascia. Okay, It's a thick, broad structure, goes from the medial calcaneal tuberosity and actually extends all the way up to the proximal phalanges. So you can actually feel this if you do this kind of sitting with your bare foot. If you kind of take your big toe and kind of pull it back towards you passively, you'll actually, most people will feel a little bit of a stretch, and you'll actually see on the bottom part of your foot, your plantar fascia will become very prominent, okay? So that's one way you could kind of see it on yourself. And again, the plantar fascia has some responsibility. It assists in stabilizing the medial longitudinal arch and also helps to propel the body and move it forward. So if you kind of look at the pictures that are on this slide, you can kind of see it's also very kind of closely linked with the Achilles tendon. So again, the ability to add support for the foot, and again, there's problems that can occur with this. A plantar fascia can tear completely. Individuals can also develop what's called plantar fasciitis, where this tissue kind of degenerates and gets very sore. So those are some of the issues you could have with the plantar fascia, but it's basically just a thick tissue structure that helps to support the bottom part of the foot.